Okay, everybody, so you just need to accept the recording there. So you're very welcome along to this evening's Q&A. I think as the evenings get brighter and sunnier, I think we're probably going to have fewer and fewer people on these Q&As, and I don't really blame people because the best thing you can do for your health in the summertime is get out there in that fresh air. But anyway, we'll keep going. I see Naheed is there as well. Hi, Dr. Naheed.
Hi, Noel. How are you?
Very good, very good. How are you?
I'm good, thank you.
Good. How's the baby?
Baby is good.
Good, good, good.
Just started to walk, so you
I
can
started to walk.
yeah.
So keeping you on toes.
Yeah, like
What age is the baby?
sorry?
What age is the baby now?
1 year?
1 year. All right. Okay. Geez, time flies. Time flies. Starting to
Yeah.
walk. That's great. That's great. That'll keep you busy. Uh,
Very.
so what we'll do is we will I have a few questions in by email, and then we'll hand over to the chat as well. And let's just take a look who's online. Oh, I see a good few people there. Sarah in Galway is there, and Regina, and yeah, and there's more people joining all the time. So actually, we'll start off with just a few of the ones while we're waiting for the rest of the doctors to come on. So, yeah, this might be a tricky one. It's from Deirdre Whitmore, and she says, "My brother has suffered from consistent eye pain, a burning sensation on waking in the AM for the last 3 years. He has been to an optometrist and an ophthalmologist and has tried a combination of medications, but still suffers. Specialists said to push through the pain and get on with it. Any advice would be greatly appreciated." Push through the pain and get on with it. That seems a bit severe, but yeah. I actually had to go. I was in India at Christmas time, and I was doing the tour there, and then I went to the 10,000 course. And both my parents suffered from macular degeneration, and uh, both my mother and father. When she was alive, I was regularly bringing her to Dublin to get injections in her eye, for to help stop the macular degeneration. And this was going on for quite a long time, actually, and it was always quite upsetting for her. A, because she was very elderly and she had to go and travel up to the hospital, and B, because the injection themselves did kind of upset her. And I know quite a lot of people get these injections. So when I was over in India, I decided I didn't want that happening to me, and I'd take whatever preventative measures I could. So there's a specialist eye hospital in Kochi, a very famous one actually, because the Kenyan president's daughter had her eyesight restored at that hospital. So if you want to Google that, just put in, I can't remember the name of the lady or anything like that, but it was quite a big thing. This woman had been to all types of Western medicine and her eyesight was deteriorating. And she went to that hospital, and they did different treatments. And, she was absolutely delighted. So much so that he's the ex-Kenyan president now. He traveled to India to meet Modi, and say, look, why doesn't the world know about this? Why aren't you letting the world know about these fantastic treatments? And of course, Modi said, I'm doing everything I can to wake the world up to these treatments, but just people aren't listening. So that might be one option for that person. But there are certainly a lot of treatments that we can do for the eyes within Ayurveda. Now, Dr. Naheed, I know you did a webinar on eye treatments there for us a year or so ago, and it might be worthwhile. Actually, Deirdre, if you send me an email afterwards, I'll send you a link to that webinar on eye treatment. But anything off the top of your head, Naheed, for consistent eye pain, burning sensation on waking?
Yes, I would say that there are so many things which you can do, but I would say that gradually, because when it comes to eyes, I would say gradually introduce things like I would say Triphala powder is a very astringent and that helps cleansing your eyes. So if you can just boil a little bit of Triphala, like a 1 teaspoon in 100 ml of water, let it cool down and just wash your eyes with that. That gives you a kind of sensation of like the clear your eyes and just give you a calming and soothing effect. There's a one simple exercise which you can do is just rub your hands like that and just place it over your eyes. That also gives you a kind of a soothing and relaxing effect, and that just like kind of a comfort from the pain, for a temporary comfort. And I would say if you can, then you can get in contact with any of the doctor and get a Netra Tarpana done. So Netra Tarpana is a therapy which is done for like for few days. If you are doing it like for continuously, then around 7 to 10 days. But if you are doing it like a weekly or so, then you might need to like come and do it like for like 4 or 6 weeks. What the therapy is that there is a medicated ghee which is poured on your eyes. There is a kind of, we have done that in our practical sessions in one of our course. So there is a kind of a bridge kind of a thing is made around your eyes, and the oil is poured into that, and the oil remains there for a while till the oil's temperature comes down to like room temperature. And in that way it helps to like rejuvenate all the nerves around there. And as Triphala Grita, which is Megagekik Grita for ghee for the eyes, ghee is very cooling in nature, and because our eyes is a pitta organ, so that kinds of like like balancing the pitta effect of the eyes. Anywhere if the pain is associated, then definitely somewhere like a vata imbalance is there. So the lubrication qualities of the ghee will help you to like calm down the pain. So if you cannot do netra tarpana at the moment, then I would say just take simple ghee and just apply it all over your eyes and gently massage before bedtime. And make sure that you don't look into screen or any mobile phone or anything after doing the ghee massage. Just straight go to the bed. And gradually I would say that it would help, but most importantly, why the pain is there, the underlying cause of the pain should be addressed, and that could help you like benefited as like you I know like you must be looking for that as soon as you get relief from it. So address the underlying cause. I would say that that will help you more.
Yeah, I think Netratarpana is a therapy I've done myself before now. I mean, I had good news when I went to that hospital in India, because they sent me off to get some tests done in an allopathic hospital, and they came back and they said, look, no, you've no sign of any macular degeneration. So they didn't even have to give me any treatments. They gave me some eye drops. Probably there's a lot of pollution in that city actually, so probably just to clean out my eyes. But I know Netratarpana is definitely a treatment that they do to strengthen the eyes. So to me, that sounds like a pretty serious thing. Definitely a very uncomfortable thing. Anything to do with the eyes makes people a bit squeamish even, but like it's uncomfortable, and really you should try do something about it. And Ayurveda definitely has some things that you can do, as Dr. Naheed said there. But my advice would be really to go and have a consultation with Dr. Naheed or one of the Ayurvedic doctors, but probably with Dr. Naheed, and get on a treatment program to do something about that, So I see Dr. Richvinder is there. Hi, Dr. Richvinder.
Hello everyone. Hello,
Oh.
doctors.
I like your colors. Nice blue this evening. So we have another question from Rupal, and it says, hi, can you ask what is the healing process for psoriasis and how to avoid topical steroids? Is dry, white, flaky skin part of the healing, and should the skin be allowed to heal on its own, or is any topical cream required? Many thanks. So Rajvinder, maybe while you're on, if you want to answer that. This person has psoriasis.
Yeah, psoriasis could be quite wet as well. If it's dry, so it sounds like it is in the healing process. But you have to kind of, it's a Vata Kapha condition, even though Pitta people could have it as well. So mind the Kapha in you. If there is a Kapha diet, especially sugar and stuff like that, I'm sure that's what you're doing if you're in the healing process. We have skin soother oil. So you can apply if it's uncomfortable. Otherwise, just aloe vera gel will be enough. Just put in a spray bottle and spray it. As you said yourself, should I leave the skin to heal itself? Yeah, leave the skin to kind of heal itself. And make sure you're drinking enough water. And your stress, psoriasis get kind of quite flare with stress a lot. So there's a big kind of role of stress that play to the skin issues. So yeah, so look after the other markers as well. But in relation to your question, yeah, if it's not bothering you, not itchy or anything, leave it alone. Otherwise, you have skin soother oil, aloe vera gel.
Okay. Actually, that skin soother oil, I think, has been discontinued by India. I did go to order more of it, and they said they don't have it, but I do have quite a bit of it in stock as well, though. But looks like, unless they go back and do something. So,
The steroids kind of avoid too much use of steroid, but if you have to, yeah, just use a little bit. If it's like too much, sometime it's quite flare up is bad and you need to. But the only problem with steroid is make your skin thin and you become too much of sun sensitive and stuff like that. So just kind of more mindful use of it.
okay. So, Dr. Chitali, one for you here. This is from Maureen. It says, I'm anxious to know what you would recommend for osteoarthritis. I have CalcioCare, but I think there is another I should take. Well, you should look at the webinar we have on arthritis, Maureen. Maybe you already have looked at it. I'm not too sure which Maureen that is. No, it's not the one I thought. Yeah, so you should definitely look at the webinar. But any just general advice for osteoarthritis, Chitali?
Yeah, so osteoarthritis, again, it is a degenerative changes. So if you are into the Vata phase of life, I would suggest to take any Rasayanas. If you are ladies Rasayana is good. So you can take that, or even Amrit Kalash. And in even Moringa powder we have in a powder form. So that is also a good herb for bones. So even that can be taken 1 teaspoon along with warm water in the morning time. And try to include, if you know, like the drumsticks, so you might get it in the Asian stores. So the drumsticks are really good for the calcium support for the bones. So even that is good. Try to have like warm food items so that it helps to lower down your Vata imbalance. So Vata imbalance usually happens during this phase of life, during the degenerative phase of life. So try to balance your Vata, and that's it. Yeah.
Okay. And definitely take a look at that video that we have on arthritis. Again, if you send me an email, I'll send you a link to that, you know. So Grace has a question there. She says, evening, doctors and Noel, is it okay to eat a piece of fruit 1.5 hours before a meal? Well, I suppose it is, Grace, if you're hungry, yeah. It's always okay to eat if you have some hunger, and a small piece of fruit is not really going to destroy your appetite for a bigger meal. So I would think it's, yeah, if you're hungry, it's okay. I mean, I know when I go walking and stuff like that, I might have some dates or figs or something like that. If I get a little hungry, I just take a few of them. Obviously, don't eat too many of them because it'll dampen down your appetite completely. But any disagreement from the doctors there? Anybody saying don't eat fruit before a meal?
Not at all,
I
not
would
at
like to
all.
just, yeah, sorry.
Go
Yeah,
ahead.
go ahead.
Okay, so usually if your Agni is functioning fine, like your metabolism is fine, his digestion is fine, all fine, then it takes around 45 minutes for the fruits to come out of the stomach, and that goes into this like the larger part of the intestine. So it's absolutely okay if you are eating it 1.5 hours before your meal. It's just that you are eating it before your lunch, like before your midday meal, and not before your evening meal. And make sure that your fruits are not cold, so you are not taking out from the refrigerator and instantly having it, because that's going to suppress your Agni. And when you're planning to have your big meal 1.5 hours after having the fruits, yeah, I would say that that would be fine. If you're not diabetic, if you are like absolutely fine, then you can have like 2 to 3 portions of any fruits as per your body type. And if you want it to digest like a faster way, then I would say a pinch of cinnamon and a pinch of black pepper powder could help you to digest your fruit faster. And it also helps you to like not spike the blood sugar level after having fruits.
A pinch of cinnamon.
Yeah, a pinch of cinnamon, a pinch of black pepper powder.
Okay. And I don't think there's any need to keep fruit in the fridge, really. Yeah, I wouldn't tend to keep it in the fridge myself anyway. So, but there's no need for the fruit to be cold. It certainly shouldn't be cold when you eat it, you know. So Charlotte Young says, "Hi all, I have a question about corns. I have one between my fourth and little toe, which is quite tender. So, Rajvinder, corns?
Yeah, they're a bit nasty. If it's quite tender at the moment, just soak them in a mixture of baking soda and Epsom salt kind of water, kind of do a feet bath. And you can also do, if you have inhalation oil, because of the camphor and eucalyptus tea tree, that kind of antibacterial, antifungal kind of oil 634 oil will help to numb it a little bit. You can put on a piece of cotton, keep it between the toes and wrap it and sleep with it. The pain might be better the following morning. You have to file it if it's possible, if it allow you to keep the skin thin, and unless you have to go to your there's podiatrist, the food feed people, they might file it down for you and give you some solution to apply on it. Thuja is a remedy which seems to be very good for corn and warts, that kind of things. Maybe worth taking that. In Ayurveda, you can keep it soft by applying coconut oil or aloe vera gel. So you just keep it soft, because if the skin is hard, and that's gonna give you more pain. So these are the simple things you can do. So yeah.
And make sure you wear a very comfortable, very loose fitting shoes.
Yeah.
Okay. So this person, this lady says she's been bloated since February. I had a couple of days on liquid only, also had salty, warm water to cleanse, and I was still bloated. I am taking Amrit Kalash for 2 months now. Also, the Ayurvedic Maharishi doctor at the 10,000 gave me, that's at the 10,000 course, gave me organic gut health to take 2 tablets 1 hour before bed, but I'm still bloated. I did 2 sessions of cleanse, 2 days taking liquid only and salty water, but even during these 2 days, I kept being bloated. I gave a stool sample and it came out all good. I just gave blood as well, but some results came out. I haven't seen it, but they said B12 is slightly raised. My appetite since the 2-day cleanse is back. I want to eat 3 times a day, but still bloated even in the morning. I go to the toilet every morning when I wake up, sometimes twice a day. I also drink salty water first thing in the morning. Thank you. Okay, so bloating. Any of the doctors want to take that one on?
Yeah, so bloating actually, again, if she has done cleansing like twice, but how much gap it is, like how much duration you have done. So that is also really important. If it is like back to back, then again there might be a vata increased production in there. So Apana balance will also help here. So you can take like Apana balance, which will help to reduce that bloatedness. And if you are taking any lentils, so try to use the herbs into that and the spices into that, like the asafoetida. That is the best herb, and even the carom seeds, along with turmeric and cumin. So try to use these spices into your cooking, and sip CCF water, that is cumin, coriander, and fennel seed water. So that will also help to keep your vata in balance. And again, after having your meals, try to chew like 1 pinch of carom seeds and 2 pinch of fennel seeds, and just chew them. And then after that, you can just swallow that and drink warm water over it. So these few changes, if you try to do, and just look how it works.
Yeah, I mean, I think Hingu is definitely, Hingu Vaskacharna is definitely helps with bloating, you know. And it's funny that it's there all the time. What about this drinking salty water first thing in the morning? Is
Yeah, I
this?
was wondering about that too. Like,
Yeah, why are you drinking salty water? Well, it's hard for you to answer that, you know. Is that an Ayurvedic recommendation to drink salty water? No.
No.
and she's Vata Pitta constitution, so you need to look into that. Then why that much salt you're taking first thing in the morning? Maybe reduce that or stop that and see.
Yeah, I'm not too sure if somebody told you to drink salty water in the morning. I know sometimes people clean their nasal passages out with salt water with a neti pot, but that's a different thing, you know. But drinking salty water, yeah, I'm not
Some
too
of the
sure about that.
yoga,
You know?
maybe
Yeah,
some of the yoga and the cleansing she's following. Yeah.
yeah. But I think the Hingu in your meals, asafoetida, will probably make a big difference to help with bloating, you know. But just do some of the recommendations that Dr. Tutali recommended there, and just see how it goes. But yeah, the salty water, it might not have any effect on the bloating. I was just wondering why you were taking it, why you were drinking salty water, you know. So we have a similar question from Fiona on an email, and it's a bit long, this one, but we'll read through it. I suffer with IBS, and about 8 years ago, I regretfully did a food intolerance test by post. Raj, I think is that your computer? I'm just going to put you on mute, Raj, and so you can.
Yeah.
Oh, yeah. Ooh.
I
You
got
mute
too much.
yourself and I'll
Mute.
unmute you.
I'll-
Yeah, I think it's coming through. There's that thing is coming through. So I regretfully did a food intolerance test by post where you send a blood sample to them. It came back with the usual suspects: cow's milk, peanuts, wheat, gluten, egg white, and egg yolk. You then had a consultation with a nutritionist who told me about the FODMAP diet. I stupidly cut out the foods on the list, plus other known foods like onions, garlic, beans, etc., that can cause a reaction. It did help alleviate a lot of my symptoms, but I was then wary of reintroducing them back into my diet. Over the years, when I am feeling brave, I try to reintroduce some of them, but they do cause discomfort and sometimes an upset stomach and wind. My question is, have any of the doctors come across patients that have successfully reintroduced foods, or have I left it too long now? Sadly, I didn't know about Ayurveda back then. Otherwise, I would have done things a lot differently. Thank you. With best wishes, Fiona. So this lady had IBS, or maybe has IBS. I suffer with IBS, so maybe still has it. Did a food intolerance, cut out a lot of different foods, but it did seem to have a positive impact on it. But obviously has left her diet very restricted, and wants to know what would be the Ayurveda thought on that, you know, in relation to reintroducing those foods, or would Ayurveda even have approached the whole thing in a different way altogether, you know? So maybe Dr. Rajvinder, you can let's see if I can, hang on a second. Okay, Rajvinder, you should be unmuted now. You should be able to unmute.
Yeah, thanks. Yeah, absolutely. What you did is probably that's what Ayurveda would ask you to do. Depends on, well, that's it, the sensitivity test, and at least you know you're sensitive to certain thing. But yes, of course, Ayurveda can help you to bring the food back slowly, probably with the help of some herbs and some different kind of recipes and things. So I would suggest get in touch with one of the doctor and they will help you, definitely assist you to bring the food back. Of course, your gut is seems like there is a lot going on with your gut, that you're sensitive to that much food. And normally people are sensitive to maybe one or two things. But when there is that much amount of sensitivity going on, you need to kind of look into the whole picture. As we always say, Ayurveda is not only looking into your body, it's also looking into mind, body, your environment, and other factors that might be contributing to it. So yes, I can positively say, and I have treated patients with IBS, taken the food out and introduced the foods again. Might take a little time, but eventually it is possible. Yes. Yeah.
Okay, so that's a positive answer anyway, you know. Okay, so there was a question in from Bernie Rowan. She sent it in to be my email, and I see it on the chat as well. And it's asking about how Ayurvedic treats a peptic ulcer, as it can be a medical emergency. I know pitta pacifying is the first step, but what next? So, Dr. Strzelecki, a peptic ulcer?
Yeah, sure. So again, peptic ulcer is a pitta imbalance. So in this case, what I would suggest is like try to take licorice powder. So that will calm your pitta, along with a little bit of ghee. So try to take it in the morning time, and again half a teaspoon of amla. So this will help to keep your pitta in balance if you take it early morning, in the morning time, so that later in the daytime it will be like the pitta won't try to aggravate much. And try to have like pitta pacifying diet again. As Bernie knows that she has done our self-care course, so she knows more. But again, there are like many things to do. So just start with this and see for a month or so how it goes. And we even have this Ashgod paste. I don't remember the name. It is in
MMA 3323.
MM3323. Yeah. So that is also one of the good option to take, like in the morning time. Take it empty stomach. Just take 1 spoon of it along with warm water before the breakfast should be fine. Yeah. So even that will work for peptic ulcer.
Okay.
Yeah,
And then,
sorry.
go ahead, Rajvinder.
Sorry, as part of that question, I just saw her question in the chat. She's also talking about Helicobacter, which is H. pylori. Sometime, if you are positive for H. pylori, H. pylori lead to the ulcers. So you need to see which started first. So that's the thing. So if there is H. pylori and that's the acute stage of it, of course you go to antibiotics and calm it down, and then you follow the Ayurveda protocol. Ayurveda can help with that, definitely can help to maintain that bacteria into the silent phase.
Okay. And like a peptic ulcer is a serious thing. It's a very painful thing. It needs to be dealt with, and maybe a consultation with an Ayurvedic doctor where they look at your whole diet, how you're handling stress in your life, all of these factors that come into play with these things, you know. So Bernie, I'm sure I don't know who it is. It's obviously maybe somebody you know or something like that. But for them to have a consultation would be a good thing to think about as well, you know. So there's a question in from Margarita, and she says, I would like advice on my right foot. A friend dropped me off and accidentally drove over my foot. Okay, very painful. Lucky it had not broken any bones, according to the paramedic. But my blood pressure went sky high. I don't really want to take blood pressure tabs. Is there any remedy for me, as my foot is bruised and the pharmacist suggests Larnica? I am sleeping a little bit more and tired. Is there anything you suggest? Thank you. Well, I'm not too sure, Margarita, if your blood pressure stayed up. I mean, obviously, you know, your blood pressure would react. I mean, that's someone driving over your foot is a painful thing, and it's a traumatic thing as well. So maybe that had an immediate effect on your blood pressure. But as everything settled down, maybe your blood pressure settled down as well. So the pharmacist is suggesting Larnica, and she's sleeping a bit more tired.
She has arnica, yeah, arnica,
Arnica, yeah.
which is for shock, yeah. So I say arnica might settle down the shock and bring your blood pressure down. You can do a little bit hawthorn tincture, or if you have access to the hawthorn berry tree or something, just make a little tree by either at the moment they should be in season. The blossoms should be there. So you can take the flowers, or you can take the berry and make the tea, like just boiling the flowers into the water and drink that. Or you can easily get the hawthorn tincture if you're following the arnica. So that should be good. Or one of those little I need to think about it. Homeopathic remedies, the back flower remedy. There could be one for the trauma. So take that. That might calm you down. Seems like your blood pressure is just a little trauma related. If it's lingering on, yes, there are herbs that can help.
Yeah, and you do say you're sleeping more and you need more rest, and that's fine. Then absolutely go with that. That's your body's way of reacting to the situation. So go with it. Take more sleep and have more rest. And then as you get some distance between yourself and the event, hopefully everything will just come back into normal. Like thankfully no bones were broken or anything like that. So you just take plenty of rest, look after yourself, nourish yourself, and yeah, hopefully you'll just come back into balance and follow the advice there that Dr. Richvinder gave, you know. So actually, we can go back to some of the questions I got in at a few of the previous Q&As. We never even got a chance to answer all the questions, and we definitely have lower numbers on now, which I was expecting coming into the summer. So we might be able to get asked some of the questions that we missed in the last call. Maybe these things have already resolved themselves, but they might be relevant to somebody else. So someone asks, please can I ask appropriate treatment for hemorrhoids? I am 49 years old, fit and well, and weigh about 50 kg, height 5'3", and that's from Sonia. So that's a lady with hemorrhoids who does not appear to be overweight or anything like that, and is fit and healthy, 49 years of age. I know we have a herbal for hemorrhoids, but if there's any other suggestions, Dr. Naheed?
Yeah, so if it's painful, then you can take 6 baths. So you can take a big kind of a tub and you can have warm water in it. And I would say that a little bit of turmeric in it. You can apply, like you can just mix it in the water and can sit on that. That will help you to calm down the pain. So in hemorrhoids, usually your vata, pitta, kapha, and all the 7 tissues are involved, and your digestion is really hampered. So usually, as per Ayurveda, that when the digestion is out of balance for a longer time, and your apana vata, one of the subtype of the vata, remains out of balance for a longer period of time, then you develop hemorrhoids. So the first thing would be that you need to correct your Agni. I would say that lassi, so you can churn or you can like whisk maybe around 2 tablespoons of plain natural yogurt by mixing at least 4 times of water in it. So because the digestion, like we have to ignite the digestion. So initially, so you need to add more water and then can gradually make it like more concentrated. So I would say 4 times water and just adding a pinch of cumin and black pepper powder. Do not add any salt in it. Just whisk it really properly and have it during lunchtime. So lassi is one of the excellent remedies when you have hemorrhoids. Just try to correct your digestion and see like in what stage of hemorrhoids you are in. What we need to have like more details, because if the vata is dominant or pitta is dominant or kapha is dominant, the approach will be very different for a vata or a pitta or a kapha dominant hemorrhoids. But these are the generalized thing which you can do: having lassi, correct your digestion, and take a seeds bath to just cool it down. Yeah.
Okay. Okay.
One
Very
more
good.
thing I would like to add into that. So avoid like constipation, as Dr. Nahid said. Just try to have lassi along with the meal during the lunch, and then try to add in prunes in your diet and the resins, so sultanas. So that will also help to ease your bowel movements.
Yeah. Do not let your apana vata goes like out of balance.
Okay, so I think another question for you, Dr. Nahid, actually. This is from Ellen. She is a 1-month-old baby. She is fully breastfed. She has a lot of wind, and it seems to really affect her in the evening and at night. We burp her, but she never seems to burp, only farting with some strain. Is there anything I can give her to help with this? Also, is there any diet advice for me while breastfeeding that may help her too?
Yeah, so hi, congratulations, Ellen, for your newborn. I would say, see, from baby when they are newborns, so from the day 15 to the day 45, so around 1.5 months, all the baby are physiologically more prone to develop a lot of gas, and they are sometimes referred to as, like colic. So do not worry about it, like don't stress yourself too much about it. Once your baby gradually grows up, like 2.5 or 3 months old, it will slowly come down. But to give her a relief and to like also stress free yourself, I would say you can have something called caraway seeds and fennel seeds. So because it's summertime and the temperature is quite, like warmer, the weather is quite warmer, so do not have a lot of caraway seeds. Just a pinch of in a glass of water, just boil it by adding 2 pinch of fennel seeds, and you can have it. So it will keep your vata, like in a balanced state, because during the childbirth, a lot of vata goes out of balance. And try not to eat so much of a spicy or the stale food. Try to eat fresh, cooked, homemade food, all warm food. So that will keep your digestion nice and clear, and that will also help your baby to not become gassy. I can see that you're saying that your baby is not burping. At this age, it's quite common that baby just doesn't want to burp at all, but you need to keep on trying. If you are like making your baby sit and trying to burp her or him, okay, try to burp her, then if she's not doing, then you can hold her in your shoulder and just keep tapping her till the time she burps. Once you make become successful in making her burp, half of the problem will gone. Apart from that, what you can do, there are few exercises which you can do, is like you can bring both of her legs to her chest. So that will help. It's similar kind of a wind releasing pose which we do as a yoga asana. So that will help to pass the air from her stomach. And also hingu. So you can take a tiny pinch of hingu, very small pinch of hingu, and mix it in warm water nicely, and you can apply around her belly button. So all this simple thing can help her to um, calm down her. And if it doesn't work, then you can email me. You have my email address on the websites, and I can, like, discuss more things in detail with you.
Okay, that's great. So we have no more questions in the chat. So if anyone has a question, they can put it in. I'm going back over the questions I had. I'm just not too sure whether I asked these or not, but we'll do a few more anyway. We might end up finishing up early this evening and everyone can go for a nice walk. But anyway, this is one I don't think I asked it before. If the doctors remember this, they can tell me and we can go to another one. This is from a lady called Sheila. She's a 76-year-old and seems to be having hot flushes. I read that it might be a sign of imbalance of hormones. Is there a blood test I can do or maybe some other action I can take to alleviate this problem? Does not occur every day, but sometimes 3 times a week. Not sweating, but very hot and red in the face. So this is a 76-year-old lady who's having hot flushes. Any one of the doctors want to come in on that?
Yeah, she can definitely get request a saliva cortisol level test. Sounds like her stress hormones are fluctuating and could be stress hormones. So take vitamin D if you're not taking it. So that will help your hormones anyway.
Which vitamin, Brentvinder?
Vitamin D.
Okay, vitamin D. Okay, and what was the name of the test again?
Saliva test, it's for cortisol.
Cortisol. So test for cortisol levels. And if they are elevated, that's associated with stress, really, isn't it?
Yeah, she's 76, so really shouldn't be having hot flushes. It's not related to, I think, estrogen, unless there are other symptoms of estrogen dominancy, like we need to kind of know more if it's specifically female hormones related. But that age doesn't really sound, but some ladies do get hot flushes around that age as well. So make sure her hydration level is good. She's sleeping well. Nothing else is going on. So
Okay.
find out why it started.
Check for the blood pressure as well, I would suggest.
Yeah, it's a pitta imbalance. So
Yeah, pitta imbalance.
Yeah, so check for blood pressure as well. So this is a question from Kay Walsh from the 24th of April. I've recently developed dry eyes. My eyes feel as if they were scratched and sore. I got drops and night ointment, which took a while to bring relief at the time. Now, 1 month later, the condition has returned. I'm wondering if there's an underlying cause. I hope you can help me out with this. So I presume the treatments we talked about earlier on, the Netratarpina and the Triphala wash and things like that would help, but an underlying cause is what the K is asking about, which I suppose is always what we should be looking for. Eyes are a pitta organ, really. So pitta condition. And Naheed, you're the eye specialist or one of our eye specialists.
Sorry, Noel, I was just typing some answers, so can you just repeat the answer for me? A question.
Yeah. Okay, my eyes feel as if they were scratched and sore. I recently developed dry eyes. They feel as if they're scratched and sore. I got drops and a night ointment, which took a while to bring relief at the time. Now, 1 month later, the condition has returned. So she probably stopped using the ointment and it came back. I'm wondering if there's an underlying cause. I hope you can help me out with this. So, I mean, obviously, all the things we talked about earlier on would help bring relief. But what would be an underlying cause for that particular condition?
Okay, so the dry eyes can also indicate sometimes that your body is very dry. So if you find that your skin is also drying and if you're constipated and this indicates that your body is dry, then I would say try having at least 2 to 3 teaspoons of ghee in your diet so that your system is lubricated. And dry eyes could be it could be because of most importantly that you're using a lot of screen time. So that's I don't know why it's echoing.
It's her gender again.
no.
Sorry. Okay, go ahead, Naheed.
Yeah, so most it's quite most common that you're using your eyes too much, whether on the phone, whether on a screen, whether you're working. So I would say that the 20-20-20 rule exercise you can do to help your eyes. So for every 20 minutes when you're watching on the screen, look away for try to as far as possible 20 seconds, up until if you can see anything to 20 feet. So, and simple few exercises just to like increase the circulation around the eyes, that could help. Or maybe if you are it could be like if you're already using a spectacles, so that could be a change in your number. So get your eye checked whether your number has like, increase or like what's going on. Apart from that, I would say that meet ophthalmologist if that's possible, and get it checked whether there is anything underlying which is leading to like dry eyes, and if any of the doctor wants to add anything to that.
Yeah. External application of ghee will also help, but again, just try to do that for 15 to 20 days and then just observe that.
Yeah.
Or yeah, even Netratarpana will be a good solution for that.
You can also talk to one of us. We might be able to
Mhm.
find out, might be a vata imbalance going on. And we normally recommend nasal drops as well. You can try the nasal drops because that sounds like dryness in your sinus area. So yeah, try the nasal drops. And then as Dr. Naheed suggested, ghee, just use a little bit ghee with your clean hands and just apply on your eyes and see if that helps. Just doing a little bit at home. Yeah, so water, make sure you're hydrated enough. That's the thing I say. Summertime, we don't, they're not in the habit of drinking enough water, and then make sure you're drinking lots and lots and lots of water because your liver needs to kind of cleanse things. Otherwise, the heat is building up in the body, and then you are too dry. So.
Okay, lots of suggestions there. There's a chat in, says, ready to start my millet porridge tomorrow. Should I add salt? Javinder?
Really, if you fancy. I know in the Western, people like little salt with their sweet things. So if you want a little bit pinch of salt, but it's not necessary. Like if you're using a little bit of maple syrup, or if you cook it and let it cool down a little bit, you can pour a little honey. You can do that. If the honey is too heating for you in sunny day, then you're probably making it savory. If you're making it savory, yeah, then with pinch of salt is no problem. Yeah, that's okay, no problem.
Okay, so we have a question it was from the last Q&A. This is from the 24th of April, and it's from a lady called Barbara. It's about her daughter. She has a daughter in her late 20s who suffers from social anxiety. She was a gentle, shy child, but did fine in school and college, although not a great socializer. She is happy mixing with her immediate family, but not extended family. There was a row in the family a few years ago that affected her, I believe, exacerbated her anxiety. Her dosha is probably a mix of Vata Kapha. She eats really healthily, doesn't drink any caffeine, teas or coffee, just herbal teas, doesn't take alcohol either, drinks plenty of water, takes supplements of zinc, omega-3, magnesium. She is pescatarian. Lately, she is facing a social situation she doesn't want to join. She gets acute lower back pain. She also suffers from heavy, painful periods affecting her bowels. She has tried Agnus Cactus and Raspberry, but to no avail. I know that CBT would probably help her, but she won't broach the subject at all. I really want to help her. Any ideas would be wonderful. Are there any other supplements or herbs which might be of benefit? There are several family members on her father's side, including her father and grandmother, who have had anxiety issues. So it's likely a genetic predisposition too. So I would say, just off the top of my head, one of the things that might help her a lot would be to learn meditation. Well, any good form of meditation, but the one I learned and found very, very good was transcendental meditation. And I think it instills an awful lot of confidence in people. I've seen that as a teacher of TM over the years. I've seen that repeatedly, that people develop confidence in themselves, and they get on better with other people around them, and they're less argumentative. I'm not suggesting she is argumentative, but they just become stronger in themselves. And obviously, when you're stronger in yourself, then you're better at dealing with all the situations that life throws at you. So that would be one thing that I would suggest, is that she learns transcendental meditation. Anything else from the doctors, maybe with the heavy periods and the lower back pain?
I would say it looks like there is, like, in general, the vata is involved because the lower back is the vata region. And of course, like vata is not only any of the doshas, whether it's vata, pitta, kapha, they are not only goes out of balance because of only the diet and the lifestyle, because they are emotional factors. So, and you're mentioning that there was like something there. So because of some emotional factor, your vata can goes out of balance, and that leading to, you know, heavy periods, like heavy pain. That indicates that the apana vata is like on a toss, and overall in general, the anxiety is a sign of that your vata is out of balance. I would say that this is a very sensitive topic. Any general advice would not be a good idea for a 20 years old. I would say meet any of the doctor. If she's happy to talk alone, then let her be with any of the doctor, or maybe you can join with her, and just, you know, just let her speak what she thinks, like what's the thing which is making her more anxious, and just look into her diet and the, you know, agni, and like her dosha aspects. Overall, she needs, you know, correction in all of those parts to bring her vata into balance. And Noel has already suggested that meditation. So anything which can calm her mind, you know, any form of meditation and yoga, which can like make her feel more enlivened, could help her. So I would not like to give any general advice, but I would say that I would recommend that you meet any of the doctor, because it's really sensitive.
Yeah, yeah, good advice there. Just in general for people, now not related to that one, but if you find you're the type of person that if something happens to you at work or with a family member and you have a little disagreement, and then you find that you just can't let go of that, that it's playing on your mind all of the time and you can't go beyond it, and every time you meet that person, it just comes back up, and you know, you just that's a sign your system is out of balance, you know, because arguments and fights are just part of life. They occur, and somebody can just be in bad humor someday and they react to you badly, and then, but you know, the whole idea then when we sleep at nighttime, part of the process of sleeping is to get rid of all of that. We do all this healing goes on when we sleep, and what the brain decides to do is to get rid of what it doesn't need anymore, and then what it does need to keep, it puts that into long-term memories. But if it's putting petty things into long-term memories and you know you're not getting rid of them, that's a sign that there's an imbalance there. And it happens to quite a lot of people actually. And you know, just small little things just get blown out of proportion and people end up not talking to each other, or you can't sleep at nighttime. And you know, you can have an argument with somebody and that night maybe you have difficulty getting to sleep or it plays in your head. But if that's going on for weeks and weeks and longer, it's a sign that there, unless it was a really serious thing, you know. But if it's just a general thing, it's a sign that there's an imbalance in your system. And if you find yourself being very judgmental, very angry, or just blaming the other person, or putting the logic going through your head, and then all the time coming out, well, they shouldn't have done that, they shouldn't have done that. It's very much a victim status that you've got yourself into, and it's very much a sign that your system is also out of balance. And I think one of the best ways to bring yourself back into that balance is through meditation, yoga, and pranayama. And they're an essential part of Ayurveda. We always talk here about, you know, the physical things, the herbs, the, you know, the different daily routines, all those things. But meditation, yoga, and pranayama are an integral part of Ayurveda as well, you know, and particularly meditation is a very powerful tool for letting you get rid of all of that nonsense that can take a grip of your life, you know. Because after all, if you're going around feeling that you've been abused by the world, or you know, feeling that, you know, you've some great anger against somebody or some situation or something that's going on at work, the person that's affecting most is you. You're carrying that around with you, this anger. This is affecting how you're seeing everything in life. And the best thing that we can do with all of those type of things is just move beyond them and not let them have a grip of our mind anymore. So if you are very easily gripped by these things and can't get rid of it, and then I would seriously suggest you take a look at doing something like transcendental meditation or another meditation technique. And definitely yoga and pranayama will also be very good for those things as well, you know. So that's just an aside. It's nothing to do with that 20-year-old girl. I think the advice that he gave there is very good. Rajvinder, you wanted to say something?
Yeah, that's a wonderful advice. No, that's good in general if there's anger. But I feel in this girl, 20-year-old, it's a very serious hormonal problem that she's having social anxiety, and it's not something new that she developed. So it is like you can work between her doctor and between the Ayurveda practitioner if you like to correct that imbalance. Yeah, I have come across that before. So it is something that need a lot of work to be done on this drug. So
Yeah,
So-
no, as I said, I wasn't referring to that particular situation. It's just that it brought it to my mind, you know.
Yeah.
I think Naheed's advice there to have for that person to have a consultation
talk
so
to- yeah.
that they can get a good look at it is, but it was just more of a general comment, you know. So Regina says, my mouth dried up during the cleanse and I'm still having some problems. My tongue has gone very whitish. GP has taken full bloods to be tested. I feel well hydrated and no bowel issues. Any thoughts? Only thing different in my diet is a tiny amount of Celtic salt I was taking for minerals. I don't think the salt would do that, but you know Regina very well, Rajvinder.
Yeah. I think there was a lot going on recently, so I think it's the effect of that. So yeah, so I'd say, even though you're saying you're hydrated, and I'm happy that you're taking Celtic salt. That's good. That will help you for hydration on the deeper level. I'll write you a few things to do, what you can do, but make sure you're drinking enough water and eat some juicy fruits like grapes, so that they also hydrate you. Golden kiwis and even the cranberries, things like that. I think that should take care, because you've gone through very bad kind of stuff. So yeah, that will help. I'll write to you about this. Okay.
This is again from the April Q&A. I don't think we got to ask it. It's from Cheryl. And she said, following an MRI, I've been told I have goiter and would like advice on what Ayurvedic medication to commence on, please. Dr. Stracheli, goiter?
Yeah, so goiter, again, like you have to see how your thyroid function is working. So usually it is the inflammatory condition here, and again the imbalance of all the three doshas, so Vata, Pitta, and Kapha. So in this case, like try to have like iodized salt, I would suggest. So that is one of the recommendation to have. And then even like we have one of the tablet which is called as Kanchanar Bukul. So that is also MA3346 or something. I don't
369.
remember.
3697.
97.
3697, yeah, MA3697. So that is also a wonderful herb. But again, I would suggest like only talking with only one symptom. It is very difficult to suggest to take you this tablet. So it's better to go for a consultation and just take a good advice from any of the Vaidyas.
Okay, so we're just going to take a few more questions and then we're actually going to end up a little early. It's kind of fortuitous we've fewer people on because I'm actually, as I said earlier at the start, of a little bit of a head cold. So I just want to get a bit of rest earlier tonight, you know, but we'll take one or two more. So this is from Christine and this is from April as well. So she's probably not on the call, but hopefully she'll get to watch the replay. Can the doctors recommend something to reduce dampness in the body? I'm living on top of a very misty mountain and the dampness has got into my muscles and they've been very achy. So yeah, well, I suppose the obvious thing is to move house, Christine, but that might be a bit dramatic, you know. So dampness in the body. So I presume it's a kapha thing, is it? Would be a kapha thing.
Yeah.
Yeah, definitely. Yeah.
So how do we reduce kapha? So we, you know, black pepper, ginger, all these things in the diet, the hot spices in the diet, nice hot drinks, kapha tea, all of those things can help to reduce kapha in the body. Is there anything that springs to mind?
Install infrared sauna.
Infrared sauna, dry heat. Yeah, yeah.
Right, and use a humidifier so that at least your house is dry. Yeah, that's what you can do. Keep the
Yeah,
indoor-
you don't even have to install an infrared sauna. You can buy them, small little ones now, like a tent, and just
like
sit
if
in
you
them.
have a wooden cabin one, if you have
Yeah,
the
that'd
money.
be very, very nice. But infrared as opposed to steam, because we're trying to reduce kapha here. So
No,
obviously infrared is dry. Yeah, yeah. So yeah, and a humidifier to take the dampness out of the house. But then all of the kapha reducing things. So I would say take a look at the kapha lecture on the 7-lesson course. Just go back over the principles of reducing kapha in that, and then hopefully you can do enough things to rectify the fact
Yeah,
that you're in a hurry.
turmeric, ginger, pepper, as you said, using those general spices.
Yeah.
Cumin.
And even Trikatu churna, so just take it along with honey before your meals with warm water. So that will also help to reduce the kapha imbalance. Or ginger relish is also one of the good remedy to just keep the kapha in balance.
Ginger relish. So what would that be? Ginger and
Has
lemon and
ginger,
honey, or something
So-
different?
yeah, ginger with honey. So it is like 1/3 of your jar should be with the grated ginger. Just take grated ginger and then put 2 tablespoons of honey into that. And then 1 lemon, like squeeze lemon juice into that, the full lemon juice. And like half or 1 teaspoon of pepper powder, black pepper powder. And just mix it well, keep it in the refrigerator. So before consuming, like just take it out 1 or 2 hours before your meals and take 1 teaspoon of that along with warm water. So that will also help in your digestion as well and to keep the kapha in balance.
Okay. All right, lots of thoughts there. So this is from Mary Ennis. She says, the physio advised me to get tested for gout as the soreness of my big toe and other joints due to crystallization she could feel. However, following blood tests, told my blood levels of uric acid are normal. She says, what the heck is going on? So a physio advised her to test for gout, but it seems like she doesn't have it. But she'd soreness in the big toe and other joints due to, what the physio thought was due to crystallization she could feel. Any other ideas? I think maybe definitely doing Abhyangar, a massage on the foot on that particular area is going to be a good thing. But any ideas there what it might be?
Yeah,
So-
definitely. Yeah, go on.
No, go on.
Okay, everybody will add. Yeah, so you can do, if it's pain, you did the uric acid test and then it came normal. So seems like the crystal deposition is happening. So kind of try to reduce, don't know, hard to say what kind of crystal is it. Normally it's a uric acid that can cause pain in the heel and big toes, and it's flame and red. So Noel said massage, maybe just a simple application of a joints to the oil and wrap it up and see if it can heal the pain and bring the inflammation down. You can also do apple cider. That is very good for crystal and dissolving crystals. And do a little cleanse with the food. Eat a little bit light, drink more water. See if that helps.
Okay. So just you said apple cider vinegar to help with the.
Yeah, just soak cotton and wrap it around you.
Okay. So a few things there. Okay, so what I want to do now is I just want to share my screen, and because I want to tell you about a new thing that we're doing and why we're doing it. And we mightn't exactly do it forever, but we're going to test it out. So normally, as most of you will know, when you get an initial Ayurvedic consultation with an Ayurvedic doctor, that consultation takes an hour. And the reason, that's the way we've always done it up till now. Generally, a first consultation will be for an hour. And then if you go for a revisit on the same topic within a few months, it may be half an hour or something like that. And the reason we've always done it that way is that most of the people coming to us are not over familiar with Ayurveda, and they, so the doctor has to go into a lot of things like Vata, Pitta, Kapha, the daily routine, the seasonal routine, all of these things. But we now recognize that we have a whole host of people that actually know quite a lot about Ayurveda, and mainly ye people that come on our Q&As and that have done our 7-lesson courses and that go on our webinars. And we wanted to make a system available where maybe you have some question that you want to ask, or you just want to clarify something, or some condition has come up and you just want to talk to Abhijah, but you don't need an hour. You don't need to get the basics, and you don't really want to spend it, maybe 80 euro or 120 euro. The doctors charge different amounts, So what we've done is we've introduced a 20-minute Zoom consultation, which costs 25 euro. And it's just a Zoom. It's not an in-person consultation. And you can just go online and you can just book this consultation, and then the doctor will send you a Zoom link just before the consultation time, and then you just click on and you have your talk with the doctor. So how you get to it is you just use, I'll put this into the chat box in a minute, but we use a system called Calendly, which is a really, really good system for setting up appointments. And some of you may be familiar with it from other practitioners, but our web address is just going to be calendly.com/Ayurveda Center. So I'll just take that little bit out and just put that bit in. So you can see the address to book one of these consultations up there. So it's just calendly.com/Ayurveda Center, and I will put that into the chat box when we come back. So we just have this 20-minute Zoom consultation. So you just click on that and it brings up the dates. We only have May set up at the moment, even though we will put in some for June. So you just pick the date that you're interested in. Let's say it's the 23rd. There's a selection of times there. You pick the time you want, and then you click next, and you just fill in your name, your email, your telephone number. You can give a brief description of what it is that you want to talk to the doctor about. This will allow the doctor to maybe prepare a little bit before the call. So you just can put in, I'm concerned about whatever it happens to be. And then you just pay for the consultation using Stripe, which is the same system we use on our website. So you just have to put in your name and your card number and all of that. And then immediately you'll get once you schedule the event, immediately you'll get a confirmation email. And then, as I say, you'll get a reminder a couple of hours before the consultation. And then just before the consultation, the doctor will send you a Zoom link, and then you can go on. And it is just 20 minutes. It's just a 20-minute consultation. And we're not advertising this to the public. We're not putting it out on our main website or anything like that, because for new people, 20 minutes is definitely not enough. We don't want to end up in a situation, where we're just seeing people very quickly and we're pushed for time and stuff like that. So for new people, this is not suitable, but it is suitable for people who already know quite a lot about Ayurveda. And as I say, they just want to have a quick chat with the doctor, but they don't necessarily want to have to spend €80 or €120 or whatever happens to be. So I put that link in there. At the moment, Dr. Chercelli is doing those Zoom calls until the end of May anyway. We have and we're going to just keep doing them. Obviously, we have to see if they work or not. There's no point in the doctor scheduling a lot of time to do these if people are not booking them. So we'll just play it by ear and see how they work out. Obviously, if it's something bigger, if it's a bigger thing that you want to have a longer conversation with a doctor, then you schedule an hour with the doctor, and you do that through the normal website, ayurveda.ie, where you just email one of the doctors. But if it's just something that that you feel will just take 20 minutes, one topic, not a list of topics, or you just want some advice on something, then we can use this system for doing that. Now, later on in the month, on the 28th of May, we have some shops now that are selling Ayurvedic herbals for us, and we wanted to organize some training for them on the products that we sell, so that they know, when to prescribe them and when, which is a more suitable herb to prescribe. So we've taken 3 of the digestive herbs, which is MA154, MA575, and MA320. And Dr. Rajvinder is going to do a little presentation on those 3 herbs and also do a Q&A on them. Sorry, Raj?
4 herbs, I think.
Well, you narrowed it down to 3, but do you want to do MA?
Leave it to 3. Leave it to
Yeah, okay. And so I think this would be of great interest to practitioners. We have quite a few people have done the Alma Mater course, and we have people doing it at the moment. I saw Sarah on the call earlier on, and I saw Bernie, who's also a practitioner. And I think Regina at some stage might like to become a practitioner. So this is just sort of a little more of an in-depth look at some of the herbs. And like MA575 and MA320, they're very close together in ingredients and stuff like that. So why would you prescribe one over the other? Now, also, if you're on one of those herbs, then you might like to find out a little bit more about it as well. So we're not going to confine it strictly to practitioners. We're going to do it as a general call. Anybody can come on it. And a lot of people will have absolutely no interest in coming on it. And I totally understand that. That's fine. But if you do have any interest in coming on it, just look out for our newsletter, and we will have that available. We will do more. We're making the first one available free, just to see how it goes and what sort of interaction we have. And we'll just see how it goes from there. We might do training on more herbs as we go on. On the next day, the 29th of May, we're going to have a special webinar and Q&A session on the menopause. Now, this is a new thing we're going to start doing. They're more like, Dr. Chercelli did an absolutely brilliant presentation on gut health webinar, where she designed a load of really good slides. There was an awful lot of work put into the webinar. We had a big reaction to it. We had well over 100 people book it, and we had lots of people pay for the replay afterwards. And it will be going up on our website in a while. But that was something that involved a lot of work for Dr. Cicelli to put together, and we also charged for that webinar. This one we're going to do on the menopause is, like I've said to the doctors, you have a whole heap of knowledge that will just pour out of you once you start talking about a subject. So it's not that I want you to start going away and, you know, preparing loads and loads of slides. This will just be where the doctors come on, and actually Dr. Naheed will take the lead on this and just talk about your experience of dealing with the menopause. There's no need to prepare any slides or anything like that, but just come out and talk about how Ayurveda views the menopause, the different type of symptoms that people can get, how Ayurveda deals with it, some general advices for everybody, some specific advices for things like hot flushes and things like that. Then the other doctors can come in and say, okay, well, I had this patient and, you know, we had this experience with it. And then we have a Q&A at the end of it. And this will be free. There won't be any charge for this. And so that's going to take place on the 29th of May. And then we're going to do a series of these. I think Dr. Rajvinder is going to do one on tinnitus, because that comes up quite a lot in our Q&As. And we'll do some other ones as well. And if you have any ideas for ones that you'd like us to do, you can just send in suggestions and we can put them on the list. So that's going to be on the 28th, Dr. Rajvinder's herbal training, and on the 29th, we have the webinar on the Q&A on the menopause. And as I say, Dr. Naheed is going to take the lead on that. And then we will be bringing more things. We have to see how it goes over the summer. Like, we've 28 people on the call. It's great to have 28 people, but it's very low numbers for our usual, the usual that we get. So if the weather gets really, really good, we might take a little break from doing these until the autumn again. But we'll just see how that goes, you know. And there's Jenny, says, a special thanks to Dr. Rajvinder for going to Glasgow. Grateful for all the advice. So Dr. Rajvinder was in Glasgow last week. When were you there, Rajvinder? Very recently anyway. And she's also going to Rendlesham in the...
She's on mute.
Oh, she's on mute, is she? Okay, I better unmute her. She'll be... let's see, where's Rajvinder gone? Oh, there she is there. Sorry, Rajvinder, for muting you there.
No, it was my internet was gone, so it's just...
Yeah, so you only came back from Glasgow the other day, did you?
Yeah, I was there. What days? I'm kind of lost a little bit Mondays, and yeah, I only came back actually midnight Saturday. Yeah,
Saturday, okay. And it was very busy over there. I know Angela Landers, who runs the center over there, so I think you were
very busy.
Yeah,
really a lovely community of TM people, and there were people who were just kind of talking about the TM made such a big difference in their life. And the place I stayed, there was a retired woman, a long-term Siddha, and it was such a kind of I say, soul-nourishing experience to staying with somebody who she had a lovely attic. I think it was one of the ballroom converted to now a flying yogic room. It was very nice to experience that. So yeah, Glasgow, and magically one lady said, "Oh, you brought sun with you." So 3 days were so sunny and glorious. So Glasgow's a lot happening. So it was really nice overall experience. So thanks, Jenny.
yeah. But Glasgow is a great city. I haven't been there in a long time, actually, and it's a place I wouldn't mind going back to visit. There was a guy from Glasgow on our last course up in Donegal, John. I think you met him when you were over there. Very
I met him. He was talking about yeah,
he was up in Donegal on the retreat up there. Yeah, and I think you're off to London or to Rendlesham this weekend.
Rendlesham this weekend.
Okay.
Yeah.
Okay. All right. Well, okay. So that's great, everybody. So listen, thanks everybody for coming on, and I hope you got something out of the call. I'll send the recording out tomorrow, and we still have those 2 events coming on.
And I just add on to the Scottish are lovely. All that adding the accent was lovely, especially Bernie and Regina. I could relate a lot. Like, there was lovely Scottish ladies, and one of the guys said the Celtic. I said Scottish people are very much like Irish people. I say, oh yeah, we are Celtic people, so really lovely people. Yeah.
Yeah, I mean, there seems to be a lot of liveliness around Ayurveda in Scotland as well, because we certainly get a lot of Scottish people coming on our Q&As, and have done our 7-lesson course as well, you know. So yeah, So anyway, hopefully that'll spread all down through the UK and we'll all be one big happy Ayurvedic family. So anyway, that's great, everybody. Thanks a million for coming on. Keep in touch. Come on our calls next week if you're interested in them. And yeah, I'm not too sure when our next Q&A will be, but just keep an eye on the newsletters. Our tour to India, the one I said did going out on the 10th of. I couldn't get people to go over Christmas. The tour just fills up for me, but this year for some reason, maybe because we've run so many, so I changed the date to the 10th of January to the 24th of January, and it booked out in a day, and I had a big waiting list. So I said the only thing to do was to run another one. So we're running another one from the 27th of January, the 27th of December until the 10th of January. So if anybody's interested, I'll be sending out an email about that as well soon, if anybody's interested in going on that. But we have a good crowd going on that already as well, So yeah, that's everything that's happening. So we're busy here. Okay,
That's
everybody.
Regina's magic.
Sorry.
That's Regina's magic doll. She was praying for it to go in January.
Oh yeah. Regina's on that. Regina's coming on that trip as well. And the thing about the January one is the flights are way cheaper than they are over Christmas. I couldn't believe how well priced the flights were to Delhi for the tour going out on the 10th of January. They're really good prices, They're nearly half the price of what they were over Christmas time, But that's what the My Magic Haha Regina thing is. Yeah. Well done, Regina. You have a lot of nature support. You must be doing your meditation there regularly, Okay, everybody. Jake Rudev, thanks a million. Thanks for coming on. And we'll
Bye,
talk to
Vinay.
everybody soon. Bye. See you, Dr. Naheed, Dr. Chachali. Thanks a million for coming
Yes,
on, everybody. Thank you. Bye.